Hello, and welcome to the Division of Long-Term Supports and Services, Bureau of Elderly and Adult Services training program for the Choices for Independence program. Today I'm going to go over Module 5, which is regarding the CFI definition section of the HEE 801 rule. So the changes that we made to HEE 80102, which is the definition section. Well, to start off with, we made sure all services are now defined in the rule. Previously, the rule would not define each service, instead only laying out the requirements for the service to be covered under CFI. We also added definitions for new services that were not previously covered in the old rule, like community transition services, participant-directed and managed services, financial management services, and supported employment. There were some changes made to clarify existing definitions, and we added a few new definitions to better explain the CFI program. So first, I'd like to go over services that existed in the old rule, but now they've been defined and what they have been defined as. So to start off with, there's adult day services. Those are services provided by an adult day facility licensed pursuant to HEP 818. And those services must be covered in compliance with the adult day rule, which is 801.15. The services must be provided for fewer than 12 hours a day. Next, we added a definition for adult family care. Adult family care is a housing option for participants. It includes a combination of personal care, homemaking, and other services. Must be at a certified residence of an unrelated individual or the home of a participant's relative. And when it's at the home of a participant's relative, that's commonly referred to as kinship care. We also added a definition for environmental accessibility services. That's modification to a participant's home or vehicle to support the participant's health or safety. Home delivered meals, that's simply meals delivered to a person's home. Home health aid services, so we took a broad definition here. That's services provided by a licensed nursing assistant in accordance with the Nurse Practice Act, which is RSA 326B. We defined in-home care services as non-medical, non-hands-on care to prevent institutionalization, which includes socialization and supervision. And the emphasis on socialization and supervision is what makes in-home care different from homemaker services. Non-medical transportation, that's simply transportation to enable a participant to access the community. Personal care services, that's hands-on assistance with activities of daily living and instrumental activities of daily living provided by the staff or agency licensed pursuant to HEP 809, HEP 822, or an other qualified agency certified under HEP 601. We added a definition for personal emergency response services. Those are electronic devices that enable participants to summon help 24/7. The participants must live alone or spend significant time alone each day. Residential care facility services are services provided by a licensed residential care facility or supported residential care facility. We also added a definition for skilled nursing. Again, we took a broad approach to defining what skilled nursing is. That's services identified in the comprehensive care plan provided by a registered nurse or licensed practical nurse that are within the scope of the Nurse Practice Act. We added a definition for specialized medical equipment. That's devices, controls, or appliances that help individuals perform activities of daily living or instrumental activities of daily living. Um, they can be devices, controls, or appliances that help participants to perceive, control, or communicate with their environment. They can be items that are necessary for the life support of a participant or any other necessary medical equipment that wouldn't normally be available under the Medicaid state plan. So supportive housing. Supportive housing is services provided by a public housing authority licensed as a home health care provider or by a licensed home health care provider that contracts with the public housing authority to provide services in the public housing setting. We added a definition of targeted case management and then just referred to our targeted case management rule, which is HEE 805. So we added a definition for community transition services. That's new to this version of the rule. Community transition services is a reimbursement for non-recurring expenses associated with establishing a household. Participants transferring from an institutional setting or another provided operating setting to a living arrangement in a private residence where the participant will be directly responsible for his or her living expenses may get the reimbursement. Participant directed and managed services. So that's a service option that allows participants to direct and manage CFI waiver services other than residential care. Financial management services, that's services to help CFI participants that choose to direct and manage their own services, the PDMS participants, and they get a PDMS budget, and the financial management services are to help them manage their PDMS budget. Supported employment. So supported employment is supports to help participants with disabilities obtain and maintain employment. There were a few definitions that existed in the old rule that we then clarified. So activities of daily living, that was changed to align with RSA 151E3. And in response to stakeholder feedback, we added language included but not limited to, so that it's not a exhaustive list of what counts as an activity of daily living. So we have a definition of a provider care plan. So in the previous rule, there was a comprehensive care plan, which is the overall plan for CFI services, and then care plans for delivery of certain CFI services. So some stakeholders had said that they wanted to be able to distinguish between the care plan and the comprehensive care plan more easily. So we decided to call it a provider care plan instead of just a care plan. And we also noted that some providers that make provider care plans may want to work with participants' primary care provider in developing their care plan. We changed the definition of case manager to refer to HEE 805 and included a reference to the new requirement for conflict-free case management. So for the definition of comprehensive care plan, we specified that it's developed by the case manager, and it's an integrated plan for all the participants' CFI waiver services. For the definition of licensed practitioner, that's a list of medical professionals who are considered licensed practitioners, and we just added physical therapist and occupational therapist to that list. We added a few new definitions to the administrative rule. First is appeal. That's just a formal request to review a decision. We added a definition for authorized representative, and there we just referred to the existing Medicaid rule that allows for people to appoint authorized representatives. We added a definition for instrumental activities of daily living. Those are activities that are essential to live independently, such as housework, laundry, meal prep, transportation, grocery shopping, phone use, medication management, and money management. Nursing facility services are now defined. That's simply services that are provided in a facility licensed pursuant to RSA 151, and they provide domiciliary services and health supervision. That concludes this module. Thank you and have a nice day.